are local governments preparing for the rollout of booster shots for minors? Joining us on the phone is San Juan City Mayor Francis Zamora. Good morning, Mayor. Thanks for taking our call.
Yes, good morning, Mai, and thanks for having me on CNN.
All right, booster shots for the immunocompromised minors aged 12 to 17 have been given the go signal, but for now, Mayor, only 2 hospitals in Quezon City are allowed to administer the shots. Now, how is the city preparing to roll out the booster program for the rest of the 12 to 17 age bracket?
Mai, this morning we will be rolling out here in Cardinal Santos Medical Center our booster shots for those aged 12 to 17 who are immunocompromised. So the initial list of hospitals has been expanded to include us here in San Juan, specifically in Cardinal Santos Medical Center. However, I've also opened up the online registration for all other children aged 12 to 17 so that when DOH says that the priority group will be expanded to those who are not immunocompromised or to the healthier 12 to 17-year-olds, we will already have a database and we simply have to text them as to when they will be given their first booster.
Yeah. Well, will there be a special setup like the one for children, and how many are your target vaccinees for this age group?
For today, we have a target of 10 children under the immunocompromised category. This is a very stringent criteria because they have to be either cancer patients, HIV patients, transplant patients, or with other immunodeficiency ailments. So we understand that this is a very, very small group of children, but we are preparing for the expansion of this age group to those who are healthy. And given the data that we have, we were able to fully vaccinate around 5,000 children aged 12 to 17 for their first and second doses. So we're expecting the same number for the first booster.
Yeah. When you talk about the expansion for this age bracket, in the long run, do you plan to be more aggressive in having this age bracket get the boosters, like doing, for example, school to school or house to house?
Yes, definitely. In fact, I'm calling on the DOH to already expand the age bracket because right now, if we're only going to vaccinate 10 children this morning, we have a lot of vaccines, we have our manpower, we have logistics. This is the same thing that I would like to call on the DOH regarding the second booster for the general population. We have started, in fact, we have finished giving the second booster to our senior citizens, to our medical frontliners, and those who have comorbidities. So we are now calling on the DOH if they could possibly expand this to the healthy population because we are simply waiting for them to allow us to do so when in fact we have enough vaccines, we have manpower, we have logistics. So I would rather be able to vaccinate them already, especially now that there is an increase in the number of cases here in Metro Manila.
When you say you have a lot of vaccines, I take it you have more than enough supply of the recommended vaccine, and what particular vaccine has been recommended for this age group, Mayor?
Okay, we have a supply of all types of vaccines, but for this age group, Pfizer will be given unless the IATF will add other vaccines that will be allowed for this age group. We will stick with that brand for now.
I remember there's a concern raised about expiring vaccines. Do you have an update on this, Mayor?
We never experienced any expiration of vaccines here in San Juan because we have always implemented our first in, first out policy. Whatever vaccines we get, we assess first if these are close to expiration or not. And of course, we use those that will expire earlier than those that will expire longer. So it's really a matter of checking and managing an inventory of vaccines.
Well, in terms of convincing parents to have their kids boosted, did you ever have a problem with this? And how is the information campaign going?
Let's go back to when we started giving the first and second dose to those age 12 to 17, even to those age 5 to 11. I brought my kids. Two of them are minors, age 9 and 11, and I brought them myself there during the first day of the vaccination for this age group, just to show people, specifically our parents, that it is indeed safe to have them vaccinated. And I will do the same thing once the DOH will allow this age group that are not immunocompromised to get their first booster already.
Well, let's talk about the rollout of the booster shots, Mayor. How will this be rolled out? Do they need to go to the hospitals and the health centers? And will this be open to non-residents and walk-ins?
Right now, the booster shots for those aged to 12 to 17 that are immunocompromised will have to be done at the Cardinal Santos Medical Center. And we will again await the DOH advice if we will be allowed to vaccinate them eventually in our regular vaccination sites. So it's really a matter of rolling out first this week, and let us see what changes will be implemented by the DOH in the coming weeks. But whatever it is, San Juan is ready. We have been performing well in terms of our vaccination program. And there has never been any problem here in San Juan in terms of encouraging people to get vaccinated, because our people fully understand the importance and the protection that we get from the vaccine.
Before we let you go, Mayor, what's the COVID situation in San Juan, and what is the situation in your hospitals?
Okay, we only have 31 active cases, and all of them are symptomatic. In fact, our quarantine facilities are empty. Not a single COVID patient in our local government quarantine facilities, and San Juan remains to be under the low-risk category. However, I constantly remind everyone to continue to adhere to all health and safety protocols, especially the wearing of masks. For me, the wearing of masks, this is our last layer of protection from COVID-19. We have to continue to wear our masks. And if you have not yet been vaccinated, please get vaccinated. You are welcome to get vaccinated here in San Juan. Whether it's your first dose, your second dose, or your booster shot, you are welcome to get vaccinated here in San Juan. However, for the second booster, we will have to focus on our San Juanenyo residents first, because there is a specific criteria as to who can get vaccinated.
All right, thank you so much for your time this morning, Mayor San Juan City Mayor Francis Zamora.